Major depressive disorder is one of the most well-known mood disorders, and it's characterized by anhedonia, which is the loss of interest for pleasure. Other characteristics of depressive mood include fatigue, sleep disturbance, sense of worthlessness, and suicidal tendencies. These symptoms must last 6 months to qualify as a disorder, but there are other disorders, for example, dysthymic disorder, which is very similar with the depressive mood and irritability, but it's considered more mild. Some causes of depression include chemical imbalance, genetics, biological rhythms, which means something like the seasons. This is called seasonal affective disorder, or commonly known as like seasonal depression. Situational factors also contribute to depression. Oftentimes, if you have 3 major life stressors, that is an indicator of if you experience depression or not. There's this concept called the cognitive triad, which is ideas about yourself, the future, and the world, and your place in it. People with depression often feel that they have an external locus of control, meaning that they feel they can't control these circumstances. This is called learned helplessness because they aren't actually helpless, but they feel that they are. Depression can be treated with the use of SSRIs, or selective serotonin reuptake inhibitors, which increase the amount of serotonin in the brain. There are also several effective talk therapies, including cognitive behavioral therapy, which gets the patient to change their negative thoughts, feelings, and behaviors. Cognitive behavioral therapy works through collaboration, whereas other therapies work to change irrational thoughts by challenging you like a cross-examiner. An example of this would be rational emotive therapy. One final therapy is humanistic therapy, where the psychologist gives you unconditional positive regard. Now I'm going to discuss bipolar disorder, which is characterized by manic and depressive episodes. So we've already talked about depressive moods. So a manic episode is where someone's mood is overly elevated. Either they're very energized, they're very irritable, or they're very excited. Oftentimes when people are in this state, they tend to make very irrational decisions. There are 2 main categories for bipolar disorder. So bipolar 1 is where there's an extreme difference between the peaks of depression and mania. Bipolar 2 is where there's an extreme depressive state, but there is only a hypomanic state, which is a less severe form of mania. There's also a third disorder called cyclothymic disorder, where there's less severe depressive states and hypomania. Lastly, we'll talk about schizophrenia, which is characterized by delusions and hallucinations. So we should probably define both of these. So delusions are unshakable beliefs that someone believes are true. For example, you might believe that you're being followed. Hallucinations are when one senses things without there being physical stimuli. This is often manifested through audition and vision. Schizophrenia has some physical manifestations as well, including disordered speech, disordered behavior, and a catatonic state. If you made it to the end, thank you for watching, and if you found this helpful, I have some other videos, including one on anxiety disorders rather than mood disorders. This is probably going to be the final video I can get out before the actual AP Psych test tomorrow. So, good luck. I hope you pass. This is not going to be my final video. I will continue making stuff on psychology and hopefully branch out into other things like geography and history. But yeah, have a good day.